We work with incredible kids and we get to be a part of this journey where they come in hurting and needing support. And by the time they leave here, they're at a place where they're more confident. There's so much worry coming into this. It's challenging for a family to drop off their teenager for programming and knowing that the length of stay is fairly significant. As we go through our day-to-days, anytime that the residents need anything, all they have to do is knock on a door and ask for one of the clinical team, and they're here to support. Knowing that day 1 through 5 are going to be challenging, our staff are aware of that. We're going to help make sure that you're being skillful throughout that stay. We're going to be communicating with family very regularly.
This is a treatment for the entire family system. So it's not just for the individual child. So when they first get here, we typically include the family because they're minors, they're away from home, it's kind of overwhelming. And starting to lay out a plan right away to start to just provide a framework from their own perspective. We want to help them feel safe but also empowered. The world doesn't become safer. The idea is that these residents learn that they can become braver.
For this group of teenagers who come in with mental health as well as substance abuse, being able to give them skills that they can use outside of here. When they're feeling bored in their free time, they're very vulnerable.
We're able to involve therapies like experiential therapy and incentive outings on the weekend, so they're not just here kind of secluded from what we consider real life. They're actually going and using these things in the community.
Every resident creates a self-expression book here. This is just a way for them to help rediscover themselves without drugs, as well as that creative expression. So we really encourage them to put positive things in here, inspirational quotes that they can always look back on when they leave here and continue to add to it throughout their journey.
A big thing we do with the kids is if they have a slip, after treatment, doesn't mean that all is lost and all the information you learned here is gone. So we do what's called like those sober jars. So I have them put in a little ball in there for every day that they're sober, with the understanding that should you have a relapse, should you have a slip, you don't dump the whole thing out. You just don't add one for that day. To say once an addict, always an addict is to deny what we've seen, which is change is possible.
One thing that we end our check-in groups with is talking about how we're feeling gratitude in that moment and during that day. We'll get letters to future residents of how this program has impacted them. So what we started here is the wisdom wall, where we've gotten letters from past patients to our current patients or future patients about what they can gain out of this program. We get a lot of communication from past patients, let us know that they're still sober.
Thank you for giving me the wake-up call I needed. You've inspired me to commit to fitness and aspire to become a social worker. I can't thank you enough, and I hope all is well. What they're saying is, you've given us a reason to actually see life in a way that's worth living.
When patients leave here, it's not so much of a somber event, it's a celebration, because we know where they've come from and we know the direction that they're going. We celebrate the kids when they leave.